Okay, everyone. Um, Happy Thursday. Happy Thursday afternoon. Thank you for joining us today. Welcome to Digital Health Weekly, brought to you by Luma Health, where we chat about all things healthcare. Today, we're going to spend the probably 30 to 40 minutes, depending on Q&A and where the conversation leads. To really focus on COVID-19 vaccine. Now that it's here, now what? I'm Dave Smith, and in today's episode, we have the pleasure of talking with Dr. Tashfeen Ekram about all things COVID-19 vaccine, the readiness, the delivery, and ultimately the impact to providers, to patients, to health systems. Very, very excited about this. Thank you so much for joining us, Dr. Ekram. Welcome to Digital Health Weekly. If you could take a minute and share your journey into healthcare for the participants, a little bit about what led you to where you are today. Obviously, as an expert in both thoughtfulness on where healthcare and technology are headed, but also just an awesome human that has a great background and story. So if you could give us a short introduction, we'd appreciate it.
No, thank you so much for having me. It's my pleasure to be here. I think at heart, you can think of me as a combination or a cross between someone who loves healthcare and is a digital or a technology enthusiast. And I think early on during my education, I really enjoyed science. And I found as kind of going through high school and my early years in undergrad, I really enjoyed working with patients, but I also had a intellectual curiosity into science. And so that's what eventually led me into healthcare. And I loved working with patients and I loved the science aspect of it. But I think I realized early on in my career, what was really challenging to me was that when I saw a patient in front of me, you're addressing the needs of a patient one at a time. But there were sometimes my patients are coming with problems that I couldn't address because they were problems that were much beyond what I was able to address as a physician. They were problems that were systemic in our healthcare system or in my practice environment. And my background before that, while I was an undergrad, I had a lot of interest in computer science. So I had taken computer science courses also alongside with doing some of the medical schoolwork. And so I had this seed planted in me of this kind of fondness for technology. And so when I started practicing and seeing these problems on my own practice and talking to a lot of my colleagues, I realized that technology had a huge place where it could solve these problems. And that's kind of where my professional career sort of took a fork, where I decided I would spend a fair amount of my intellectual curiosity and time in terms of trying to figure out how you can use technology to solve some problems. And then so that's kind of where I professionally said, now I spend my time continue to work as a physician as I love to work with patients and help address some of their immediate concerns, but I also like to be able to address those bigger problems because I feel like as a physician, there's only, you can only see about 30, 40 patients a day. Whereas if you can solve a critical problem in the healthcare system that is broader than just your practice environment, you could impact thousands to millions of patients. And that's what I'm hoping to do with kind of balancing my professional career working as a physician and working with Luma Health.
Awesome. Thank you for that. I know that we're going to touch on a myriad of subjects in our dialogue today, but just again, thank you for making the time for the audience. For those that have joined live today, we are recording this so if there are things that come up or thoughts that you have, certainly after the fact, we will make available this recording very soon, but also any of the key takeaways that where a penny might drop throughout the dialogue, feel free to chat your questions. While this is in a webinar format, we certainly welcome any disruption to the dialogue that is relevant to the questions that you might have for Dr. Ekram. He's a patient himself, a caregiver, a provider. He works within clinics. So he understands the nature of what many of you that have joined the webinar today from your point of view. So we're excited about that. So let's get into it. So obviously, Dr. Ekram, the first thought on everybody's mind right now is the current surge happening throughout the world and really, here in the US and of course, wherever you might be a part of your community, it's everywhere. And it is certainly here, and it's certainly present to everybody's life. Maybe, as a practicing physician, I would love for you to share your thoughts on where we are as a society dealing with the pandemic.
Yeah, I'd say there's multiple facets of how this pandemic has affected our lives, and I think it goes without saying. But I think probably as a physician, I think the one thing that starting from that kind of my perspective from there is that the healthcare system, and my experience, I practice medicine in the US, but I think this kind of goes much more broadly than that. But I'd say that the US healthcare system is taxed. I think, and there's a lot of media obviously about this, but just being in the trenches and having a lot of colleagues and several family members who are in the healthcare space, this has probably been the most challenging time for the healthcare system. Interestingly enough, if you look at, the healthcare system in the US has been going through a lot of change in the last 10 to 15 years, as we've seen a lot of different forces in terms of healthcare outcomes kind of maxing out and costs rising, and us as a healthcare system as a whole not performing quite well. And so there were a lot of changes in place. But this, the current pandemic's been going on for a year plus now, has really just taxed our system. And it has really pushed a lot of our baseline assumptions into places that I think we were not very comfortable. And I think what's the corollary of that is that we are now starting to see some of those problems that we had seen before, showing in cracks into our health system, where we're seeing that physicians who were already kind of on the brink of being overworked now had to go into 125% or 150%, and that goes for all sort of healthcare providers, down from physicians all the way down to anyone involved in the healthcare delivery. And I think what that really is showing is that it has given us the opportunity to kind of do introspection also, and understand that there were a lot of places that there's opportunity for us to really take lessons from this and to push it forward. So I think from a healthcare system, I think there is not a physician that's in the US healthcare system that could not say that they have been psychologically pushed to a point where it's on the brink of a lot of distress. And I think kind of switching gears, it's interesting. I think, like, if you look at it, the pandemic has had multiple impacts, I think, as a society as a whole. Obviously, there's been a lot of financial impact with all the businesses closing down. But what probably I think is very underestimated, and I think now we're starting to see it, is really the mental part of this, the mental health aspect of it. And I think we can maybe get into this a little bit later, but I think that for physicians has been really underestimated in terms of just how taxing it has been for physicians to be constantly working, and then the mental strength that it requires to do that, and how I think physicians are now starting to have impact of this now that we're 1 year into it. And I think the mental health impact obviously is not just focused around with physicians, because this is obviously very mentally challenging for everyone. But I think if you can imagine a physician who's working in the ER, and they're just seeing day in and day out patients coming in the door, and you're not able to do anything with them because you just don't have the resources. In the beginning days of the pandemic, we just didn't know. Now we know how we can actually treat patients, but we just don't have the resources now. And so as a physician, it's very, very challenging. Not only are you putting in all those hours to try to help those patients, but it's equally frustrating and mentally taxing when you know what you can do to help the patient and you just don't have those resources in front of you.
Mm. Yeah, that's on everyone's mind. And I mean, I certainly appreciate the gravity of what you're saying. And I think it's not lost on anyone that touches care delivery, that they don't, there's this higher calling. and in that you know, that place of goodness, which is what most you know, the majority of those in care delivery, the reason they started, they just maybe didn't perceive that this would be what it would be. And so I definitely, as you mentioned, I definitely want to circle back on mental health and mental wellness. We'll touch on that in just a little bit. My next question for you is around this concept of controllable concerns that care delivery has, and real concerns that are uncontrollable. And I would love for you to opine on perhaps the difference that we as patients should feel about the progress being made to date with vaccine um, readiness, delivery. What are the real concerns and what are the controllable concerns? And if you could opine on that, um, that would be wonderful.
Yeah, no, and that's a great question. So around some of the controllable concerns, I think we as patients, I think probably the most important thing we can do is really just trying to stay up to date or being educated about the vaccine and about what we can get out of the vaccine. I think you know, this new vaccine, and I'm particularly talking about the ones that are available in the U.S. It actually marks an incredible feat in the scientific world, because this is a vaccine that's very starkly different from all the different types of all the other vaccines that we've previously administered. So I think, you know, I think we as a healthcare system or as a nation, we should take pride in that we've been able to not only come up with a vaccine like this, actually test it, and now actually deploying it and being able to see very positive results. And I think this speaks volumes to us as a healthcare system and coming together, and as a society as a whole. But I think probably some of the most important thing we can do around that as patients is educating ourselves. What are the realistic, what can we realistically expect from this, and what is it that, you know, is still in the unknown? And then I think corollary of that is not, and making sure that we go to reliable resources, because unfortunately in this day of social media, I think it's becomes very easy to take one piece of fact and then spread it, and then unfortunately suddenly you know is that there's a particular belief about the vaccine, and then that kind of drives us into a very different understanding and perception. And so I think probably the most important thing we can do is being able to stay educated about what is really accomplishable with the vaccine. And then there's obviously the obvious resources that we should rely on, like CDC's website, for example, are great resources for us as patients, to be able to stay educated about it. And then, you know, related with that, so what are kind of real concerns around that, around the vaccine, for example? So, you know, there are certain things we just don't know. We don't know, for example, how effective it will be against future strains. Obviously, we are seeing slowly new different strains coming out, which is, it's actually a natural process. This is natural selection, so to say, of what happens when you start attacking or start to eliminate a population of a disease. This happens every year with the flu virus. We have a new strain of flu virus that comes on. But I think, you know, educating ourselves that this is part of the natural process, and that the vaccine, as we know from now, it does address all the different variants of the virus out there. But now going back to kind of what are controllable concerns, again, those are the educational sides. The uncontrollable concerns are kind of like, you know, what is a long-term immunity that we can kind of get out this, when realistically, when I have access to the vaccine, me as a patient. I think, you know, again, staying connected with and educating ourselves is probably the best way we can do this to help address some of the concerns that are both controllable and non-controllable.
Thank you. Building on this the controllable concerns. I know because we have the good fortune of partnering together on many questions that we've been receiving over the past 2 months from leading health systems and clinics and thought leaders, relatable to how care delivery can use technology to aid this process of not just education, but actually, you know, creating the delivery vehicle to balance the fact that the labor force that is going to be the administrators of this is incredibly taxed, which is what, what we open the really the conversation about, which is how, how can we create outcomes that have the largest yield, that have the least destructive additive blowback on the humans that are just trying to keep themselves healthy, plus those that are coming into their clinics and their health systems. I'd love for you to share some of the strategies that you've been made aware of, or partnered with, or helped design, that can minimize those controllable concerns. Could you talk a little bit about that?
Yeah, no, I think probably the most important factor that we've seen in helping um, keeping patients kind of in a safe place is having a proactive approach of reaching out to patients. I mean, educating them. But I think it goes more than that. I think some organizations have taken a kind of a blanketed approach of just whether it's mass emailing or mass messaging patients. But I think what really is important in this day and age of consumerization, which we're seeing a lot in healthcare, is being able to message patients where they are with information that's really relevant and personalized to them. And so, for example, what a patient who is, let's say, 30-year-old who maybe has questions about the vaccine is not going to be the same as a 30-year-old who's a type 1 diabetic, is not going to be the same as a 65-year-old who's a type 2 diabetic, is not going to be the same as someone who has chronic heart disease. And so I think what's really important, and so when what we've seen is that what is going to be most effective is being able to educate patients in a proactive manner. So knowing, for example, the vaccine is on, that we will be having doses soon, that will be available to all 65-year-olds, being proactive about educating patients that, hey, look, first of all, we're going to be getting the vaccine, and doing very customized, relevant information, surfacing relevant information to patients, I think is really important, because it not only shows that you're being sophisticated in your ability to message patients, but it also shows that you as a healthcare system understand who the patient is, and that you're not just saying, okay, I'm a healthcare system, I take care of 2 million patients, we just kind of message everyone else, say, hey, we have the vaccine, we'll inform you. But to rather say like, hey, look, I understand that you are 65 years old and that you have chronic conditions, and I understand that you actually you are at amongst the highest risk for having a really bad outcome if you get COVID. And so I am addressing your concern by saying, hey, I understand this about you, and surfacing the right educational material about why that's important, that you will come and get the vaccine when it's available, and setting the appropriate expectation. I think that is probably the most impactful strategy that we've seen our clients take forward, in terms of making sure that we are really addressing the concerns by, and it's almost like segmenting the larger patient population and being able to deliver something that's very customized to them. And so that's kind of the first step, I think, of doing proactive outreach. The kind of next step is really understanding what their concerns are and being able to get interest from them. And then that really, and particularly around the vaccine, is that being able to understand who of your larger subset of patients is interested in the vaccine, and then being able to gather those responses and interest, and being able to triage it on your side, so that you're prepared again for that next phase of when you actually have the vaccine, of reaching out. But again, I think the bottom line really is, when you're interacting with patients and you're messaging them, it's all about having it being customized and being personalized, such that the patients really do feel like that their situation is at center of your concern, and that you are actually delivering medicine, or you're being a vehicle of healthcare delivery that actually addresses their concerns and where they are as a patient.
So it sounds like there's a good amount of additive strategy and tactics that have built on what we learned from the first phase. I'm curious, if you could share with us what was learned from the first phase that we're applying to the second phase, or this surge, which is also, just on the precipice of us dealing with all the logistical challenges of getting the vaccine out there. But what what have you seen that has the highest impact to patient and providers that that clinics and health systems are deploying today to again, back to just the overarching theme, which is, this is not a factory line of machines. It's human beings that are dealing with every part of what we're up against right now. So what is learned from really the first phase to today? Maybe you could speak a little bit about that.
Yeah, when the first phase hit, I think, as everyone knows, there was a rapid closing down of clinics. And so clinics had to figure out how they could really continue to service their patients in a virtual way, or in a form that would not require physical contact. And so we saw a massive uptake of telehealth capabilities. I'm just going to use that term, telehealth capabilities, in a very generic words, which means like kind of video conferencing like we're doing right now, but also like real-time messaging or asynchronous messaging. But I think what we as a healthcare system, and we found with our clients too, was that there was a wound and we stuck a kind of a Band-Aid on there that wasn't probably appropriate for that wound. And what that means is that I think we saw a rapid adoption of telehealth technology without really considering how it would integrate within our workflows. And it was really around just I wouldn't say it was panic mode, but it's more like, I need to get something in place today so that I can start seeing patients tomorrow. And it doesn't really matter how it will integrate with my electronic medical record, how it will integrate with my practice management solution. It was more of, let me just get something that works and then do it. And that worked in the early phase. It worked well for a lot of clinics and healthcare systems. But I think as volumes of telehealth medicine started ramping up, they realized that the solutions they had implemented just didn't scale, because they were throwing human beings at it, more or less, in terms of just all the coordination that would happen. Kind of what the nitty-gritty details of it would be something to the effect of like a patient scheduled tomorrow for a telehealth visit, and they would, rather than kind of automating the engagement that would happen around ensuring the patient shows up and ensuring all the technical issues would be addressed by the time the patient comes, they would have their staff call the patient, say, here is the link, type this into your browser, or make sure you're on a computer with a microphone and a camera, etc. And so there was a lot of manual human element involved in making this process work. But as volumes scaled up, they realized this was not a solution that's scalable. And so I think one of the most important learnings that we had in the first wave was that yes, there is a very important role that technology can play in facilitating the delivery of healthcare, both in the more physical sense, of the more traditional sense, and in the digital sense. But I think it was a very important lesson to understand that what the solutions we find need to be well integrated into our existing workflows, and that then, which can mean that they can scale up as we scale from one model to another. And so what we found is that the healthcare systems and practices that kind of looked at investing in something for the long term early on were a lot more easily able to switch between the different practice models. So yeah, as we saw in the early stage of the wave, we saw a rapid closing of all the clinics in terms of the in-person visits, and transition of all the visits to telehealth. And then as the pandemic kind of quieted down, or the cases started quieting down, we saw kind of a shift back into more of an in-person, the more traditional model of having interactions with the patient in person. But then as the pandemic started rising again, we kind of saw a shift again. And the clinics and the healthcare systems that did well were the ones that invested the time into figuring out, when we're implementing these technologies, we want to make sure that it's just not a Band-Aid that we're putting on a big gaping wound, but it's actually a solution that can scale one way or the other. And I think that's one important lesson as we look at implementing solutions for vaccine delivery. And I think that even though we are in an acute phase and we're trying to solve a problem for today, which is how do we get 200 million, 250 million Americans vaccinated, and we're looking at how we can leverage digital health, I think it's really important to realize is that whatever solution we're looking at, we should, of course, be able to address the acute need that we have, but I think not having foresight into some of the, as the vaccine supplies ramp up, for example, not having the foresight to look to see, hey, this solution works for me only doing like 100 vaccines today, but what happens when I have to do 10,000 tomorrow? So I think it's really important that when we're looking at it, and this in parallels is exactly the same, is that first days of telehealth, we were doing 10 visits, and suddenly tomorrow you're doing 100. Does your workflow work for both 10 and 100? And so the same question goes, will your vaccine program that you're doing, will it work for 100? Will it work for 10,000? And I think it's really important to realize that when whatever you put in place today needs to be able to scale.
Yeah, so let's unpack that for a minute. So healthcare, the pandemic has really illuminated equity in healthcare and the ability to get care. And with the vaccine now being obviously on the doorsteps, the importance towards herd immunity means that we look at all patient populations pretty equally to achieve that goal. I would love for you to lean in a little bit on some of the techniques or the things that you think are game changers to ensure that that as our listening audience thinks about how do they operationalize getting obviously a vaccine, because we're not going to talk so much about are the supply levels right, the logistics of that. That's a whole other that's a whole other conversation in of itself. But really thinking about the provider, the patient, and now looking at the patient really from the full spectrum of getting to 80%, 85% of the U.S. What do you think's going to, what are the standards, the norms that you would like to see if you went into every health system and investigated how they're doing their vaccine program? What would it be? What would it contain? Maybe if you could talk a little bit about that.
Yeah, I think so. There's a kind of a motto that internally we talk about at Luma Health, and I think maybe the best way to verbalize it would be like no patient left behind. And what that really means is that we would like to be able to engage patients and interact and deliver healthcare for patients, regardless of your social background, your economic background, etc. And so being able to address and deliver and be a means of delivering healthcare for all. And one of the biggest challenges we've seen with healthcare systems is that and it makes sense that they're trying to leverage existing technologies they have as a means to scheduling, messaging patients about the vaccine. But if you look at a lot of technologies that healthcare systems are leveraging, there, for example, are very well targeted around patients who have access to technology, who have access to, so for example, like you may have an EMR, and with that EMR comes a particular patient portal and phone app. And some of the healthcare systems are leveraging that, and that makes sense. They have investment into it, they put money into it, they need their return on investment into that. But what that inherently does is that it selects for a patient who is who has more economic strength and who has access to internet, who has access to a phone, who has access to a data plan. So you're inherently selecting a patient, a patient that is and you automatically by that correlate, you're leaving off a significant percentage of patients who don't have access to that. And if you talk about really achieving herd immunity, there's no way you can achieve it because not everyone falls into that patient category. And so for us, when we're talking to our partners and potential folks that we're working with, what we emphasize to them is that when you're coming out with your vaccine rollout strategy, you have to understand there will always be a subset of patients who will not fall into that category that you need to have a solution for and that you need to be able to address. And I think one of the important tenets for our company, and this is what, one thing I didn't mention early on is that a lot of my early career as a physician, I practiced in Southeast Michigan. Southeast Michigan has some of the most challenging patients. Not only are they have a higher level of disease burden, but they also are very financially challenged. So they have a significant issues of access to healthcare. And so one of the central tenets, and this was kind of what really inspired us to develop Luma Health, was creating a solution that was meant for not the rich, not the poor, but the entire American population. And I think that's very important when you are looking at achieving herd immunity, because you need to make sure that you're addressing all the patients. And so having a solution that makes sure that it meets the patient where they are and not asking them to come to where you are is really, really important. And so it's really looking at what are the significant access barriers for patients to technology, to getting them access to care, and meeting the patient where they are. So that way you can really achieve that herd immunity we're talking about. Because other than that, if you're going to be leveraging some, if you don't address it as a holistic way, it will be very difficult to achieve that herd immunity.
Carrying on the same highway we're on right now, large health systems were the first to get access to the vaccine for obvious reasons of logistics and density and distribution strength. As care delivery starts to have more facets, regional health, smaller clinics, primary care, as we start to get into how to think about going from the very large hub into the spokes, and vaccine delivery begins to flow there. What do you think is different? Are they different? Should they be different? If they're not, why? If they are, why? I would love your thoughts on that.
Yeah, I think in the essence, I think their approach should relatively be similar. And the reason I say that is because the scalability of the relative delivery of vaccines that are going to happen at the large healthcare systems and at the kind of the spokes, it'll have a similar kind of workflow impacts. And so, like, for example, an average primary care doctor, whether you're in a smaller healthcare setting or a large healthcare setting, you have about 2,500 patients in your panel. So that's the number of patients that you're responsible for, and that you're going to be ultimately wanting to vaccinate to a certain extent. And so, generally, the larger healthcare system have a lot more resources, and so they have a little bit more flexibility in terms of capital resources. So for them, there may be ways for them to be able to throw kind of humans at the problem. But I think as you get into the smaller practices, I think for them the main difference would be, if there's going to be a difference, is that they should even lean heavier on technology. Is because oftentimes some of the smaller regional healthcare systems, they don't have that financial strength, or they don't have that human resource strength to be able to expand and contract programs like this of vaccine delivery. And so I think for them, it becomes even more vitally important to be able to find technology that they can leverage, and that they can integrate into their workflow, and that they can streamline the delivery of the vaccine.
So I know that you have been one of the main architects of helping to construct already in production vaccine delivery programs, leveraging many of the things that you're talking about. I know several large health systems that are now running thousands and thousands of patients, and optimizing the way that they're doing that. Would love for you to share some of your best practices that you have seen deployed today, and whether those are big broad buckets, or just small little lessons learned using the technology. Would love for you to lean into that for the audience's benefit.
Yeah, I think so. I think what we've seen work best is kind of, maybe I would say, like a four-pronged approach. So the first is, and we kind of talked about this earlier, is just about educating the patients about when the vaccine will be available. Again, and then doing this in a very customized, patient-centric way. So not just saying, hey, we'll have the vaccine available, but like, I know that, for example, you belong to this category of patients. And so I know that the vaccine is not available for you today, but it may be available in the future. So I think that's kind of like the building blocks. And it's about educating. The next level is gathering interest, because not every patient that is in your patient profile is going to want to get the vaccine. And so it's, and sorry, I should step back, is that I think what's really important is that in all this process, you need to be proactive, because what we've seen is right when the vaccine hit, the inbound phone volume has gone up 20 to 30x for all healthcare systems. And that, it's just not feasible. And that all revolves around, when is the vaccine going to be there? When can I get my schedule? What are some side of, it's just all sorts of questions around the vaccine. So I think again, the first start of it is, the first prong of this approach is educating and being proactive and reaching out to patients. The second is finding out which of your subset of patients that you're taking care of are interested in getting the vaccine. And so that way you can be proactively reaching out to them, understand who is interested in getting the vaccine when it's available to them, and then putting them on on a wait list or some sort of interest list, so that when the time is right, that you can proactively reach out to them. Similar to that is that what we've seen with a lot of healthcare systems is that there's a lot of patients who are known to them who are interested in the vaccine, and who are not known, so to say, to them, are patients who will be net new to them. So having an avenue for them also of being able to go onto your website and be able to express, say, here is who I am, here's my date of birth, here's my way to contact me, and here's like characteristics about me, so I can understand which category you'd fall in. So that's the second one. So again, first is being proactive about educating the patients about where you are in the vaccine program. The second is grabbing the list of patients, or understanding the list of patients who are interested in getting the vaccine. The next is now proactively, when the vaccine becomes available, when the category has been expanded to include a given group of patients, is to actively reach out to them saying, hey, now the vaccine indeed is available for you. So that's the next step. And then the final step is allowing patients to schedule. Now, this I think is very critical, because what we've seen is that as the categories will start to broaden, we're only going to see more and more people calling in. And so allowing patients to self-serve is vitally important. And not only to help your staff, your call staff, to be able to focus on what needs to be done in terms of other, because they're already overworked, but also it streamlines experience for the patient. The patient, this drives an incredible amount of confidence in the patient's in the patient's perception of your healthcare center to deliver what they're actually promising. And so allowing them to self-serve and self-schedule. So having a way to reach out to patients that say, hey, the vaccine is now available, and allowing them simply through their phone or whatever means you are communicating with them, be able to book the appointment right through the same means. And then finally, the last piece of it is that once they're scheduled, we know that it's vitally important not only for them to be able to get that first dose, but also get that second dose. And we're seeing is it's becoming increasingly challenging for healthcare systems to be able to do this. And a lot of it is because the patients get that first dose and they either feel like they're good, now they got their dose, now I'm vaccinated, or they get their first dose and they have some reactions which are expected. And so having an automated workflow of messaging or patient engagement, or a cadence of messages that go out after that patient has gotten that first dose, to help them understand that, hey, it's vitally important for you to come back to that second dose, and then being able to track the patient throughout that process. I think one of the big challenges a lot of healthcare systems are having is that, how do I keep track of who got that first dose, and how do I make sure they come back for the second dose? How do I make sure that they're educated enough, that they get the right education and understanding that, hey, it's important for you to come back to that second dose? And again, I think what's really important when you're looking at trying to implement something like this is that in lower volumes, you can throw humans, or you can kind of implement human workflows around this. But what's important though is, if you really want to be able to do something that scales, you need to look at technologies that help you do that, and that can help you take you from where we're at point A is where a patient is interested in a vaccine, to point Z or B or wherever is where the patient gets that second dose, and is appropriately gets the touches all along the pathway to make sure that they're getting to that. And we've done something similar with several different healthcare systems. Probably one that comes to mind is one based in the northeast of Montefiore, who basically came to us. They take care of, I don't remember offhand, Dave, do you know what their patient population is? It's like, is it,
800,000.
yeah, and so they were put to the task by their local authorities that they need to vaccinate 700,000 patients. Now, as everyone's known, that New York has started to slowly expand the patients that they're vaccinating, but they were looking for a partner. We started engaging them quite early in the process, so they were looking for a partner who could help them adopt the technology and the criteria of scheduling as the criteria widen, but also be able to get to be able to segment their broader patient into different groups so that they could appropriately message patients. And so they've been, we've seen a lot of success with them where they've been able to gather the list of patients who are interested. And then as the vaccine becomes available, they've been able to kind of load shed or message appropriate groups of patients to help them get connected and be able to get the vaccine dose.
So, with the time we have remaining, I certainly want to welcome questions. I want to shift gears a bit though, because I think that obviously there's many things that COVID has brought to care delivery that have been incredibly crushing, emotionally taxing. And all of that, of course, comes with the largest amount of gratitude from the public. My question though is if you were to flip that quarter over, so we got COVID here, it was a global pandemic, and yet COVID has also brought down barriers and advanced acceleration of this digital transformation that I think most care delivery has recognized for years. But because of in some situations misaligned business objectives that I know we've heard in some situations with academia and health, and so COVID has really brought down walls all over community health. It just is created a opportunity to sprint forward, to do things that otherwise might have taken another 5 or 10 years to become norms. So I'm curious, with this as a backdrop, and knowing what you just described. So if I as a patient, if I can self-serve, if I can communicate in the language that I want in the lowest tech medium possible, when it's on my mind, and I can receive the guidance I need, where does it stop in healthcare now? Because that really opens the door for efficiencies and this consumerization of changing the relationship dramatically. And so knowing that we as consumers use convenience in our home lives, whether it's DoorDash or whether it is food delivery of other kinds, grocery delivery, supplies, we've become accustomed to mobility, mobile first, and be able to get what I need in the lowest, easiest way possible with the highest yield. I would love your thoughts as a thought leader in the space, having designed many of what you have just spoke about, but also your vision you had years ago when you saw the opportunity that as a practicing physician, what could the world be like if on a Monday my schedule is full and then on a Friday I had actually open availability, and what could have happened if the patients that really needed that availability would have had an easier way to get to me? And so maybe if you could, with the remaining time, Dr. Ekram, is just share a little bit about that, your thoughts on that. If you had any magic dust, where would you sprinkle it? And we would just love your thoughts on that.
Yeah, I think the pandemic definitely has put forward push us forward in many ways, then I think it would have taken several years for us to get there. And I'd say if I had some magic dust, I would think one of the major challenges in our healthcare system is that the incentives are not quite well aligned between who's paying the bill and who's getting the outcome of the healthcare delivery. And so there's been a push for several years now for a shift from, of the underlying pinnings of our system, which is mostly right now what we call fee for service, which is um, which basically translates to when someone has an episode of care, you get reimbursed for that episode of care, and you get reimbursed kind of more or less the same amount. And then there's been a move for transitioning from this fee for services way to value based care, which is more of, I as a physician don't get rewarded for doing more or doing certain things, but I actually get rewarded as a physician for taking care of the patient, for reaching certain outcomes for the patient. And I think so there's been this kind of big shift, so to say, that we've been seeing in the last 15 to 20 years. So as the government and the other stakeholders have been incentivizing providers to kind of switch the way they think about their patients and be more value based, but hasn't moved. It's been challenging just because the pipelines of our healthcare system is built for fee for service world. Now, how does that relate to the current pandemic? Well, I think what we've realized is that when the pandemic first hit, we needed to figure out how to take care of our patients, even if they weren't coming in physically into our offices. And so some of that happened in telehealth visits, which were kind of like, what we're doing right, where it's like a virtual visit where we're having real-time video feed and audio. But a lot of physicians also said, hey, I need to take care of my patients. It doesn't matter if I do or do not get reimbursed for this, because it is my responsibility and my higher calling. And so I will do what it takes to take care of my patients. And so that was engaging patients over real-time messaging or via the patient portal or whatever other means there was to communicate. Now, some of those things are not actually reimbursable, are not rewarded in a financial way for the provider, but as part of physicians, I think we realize you got to do what you got to do, because patients, whether the pandemic here or not, people are still going to get sick from other things, and then unless we address them, they're just going to get worse. But I think what this has brought forth is that as a healthcare system, we have a very episodic way of looking at healthcare, which is we look at it one appointment today, and then I will not think about you as a patient until you come back 6 months later. I will not think about you as a patient, come back 6 months later. And part of that was, again, is the pipelines of our system, the way to build, the way to get reimbursed was just built around that you're able to be rewarded for that one visit, and you're able for one visit, and you're not rewarded for doing anything in between per se. But I think the pandemic showed that, you need to take care of patients between this, and then we need to shift from this episodic way of taking care of patients to a more of a continuum way of taking care of patients. And that really goes back to something that we've been trying to do as a healthcare system, which is value-based care, which is really of taking care of the patients and getting them to the outcome they need, whether it takes two appointments or takes 20 appointments. The goal is we get you to that hemoglobin A1C, if you're a type 2 diabetic, that is considered healthy for you. That may, for certain patients, be I can just need to talk to you on the phone every 3 months, and that's good. For some patients, that may mean I need to see you on a weekly basis, need to have a very detailed log of your food, et cetera, et cetera. But I think what the pandemic's allowed us to do is that we need to have a change in that model, and it's allowed us to become much more comfortable in being able to deliver healthcare over a digital means. And that could be telehealth visits, that could be doing automated check-ins via patient engagement tools, being able to help track patient symptoms between visits, and then being able to triage that from a distance. But I think what it's done is it has made us all a lot more comfortable, not only as patients, but as providers, to be able to deliver and receive healthcare over a digital means, because we're so used to doing this in person. I haven't been in practice. I've been in practice about 15 years, but when I was in medical school, if you had told me let's do I didn't, in medical school, we didn't do virtual visits. I didn't get trained on that, nor in residency. But I think we are now becoming much comfortable that you can actually deliver a very satisfactory and actually better outcomes in certain situations using digital tools. And so I think that is going to be the major shift that's going to happen on the other side of this pandemic. So if I had some magic dust, what that magic dust would do is really continue to help that kind of wave that we have seeing of us being able to switch our minds both as patients and providers from its episodic nature of health, because of course, sickness doesn't go away tomorrow. I mean, a large amount of sickness doesn't just go away tomorrow, but understanding that, you know what, a patient is sick and that we need to understand that we need to help them take care of themselves and be there for them between episodes of care.
Thank you. Thank you. Yeah, I think the general sentiment is the wind is at your back with this magic dust, Dr. Ekram. Listen, I thank you for giving us your time and expertise. We really appreciate that. You know, I think as we look at the key takeaways, you know, I think that the key takeaways and the meta messages are, number one, that we all are stressed to the max, and one of the things that is there as a supplement or a strategy is little or as much of technology, whether it's a little or a lot, is going to help. So I think that enabling that to be more proactive, to put Band-Aids over cracks that right now we don't have the luxury necessarily to fill. I know you talked about getting more value out of the EMRs and the EHRs and supplementing the investments so that you know, again, that's an example of projects that normally would have taken years. We know folks that have Epic instances that had a large Epic first mentality, obviously a wonderful, incredible company with great tooling. But given where we're at now and the need to be very digital first, we needed to support and supplement those efforts in a very fast way. And we've seen that. I think meeting patients where they are is you know, as you mentioned, equity and the social contract that we have, which is the first time that I certainly, being in my late 40s, can think about where we have a bigger calling, and if we chase that bigger calling, then the responsibility is there. And technology can help with that. So we really greatly appreciate your expertise. I wanted to use the last few minutes if the audience had any questions. We certainly appreciate you giving us the time today. Our contact information is here, and we would love to collaborate, you know, after you've had the opportunity to let things soak. And if there are parts of the dialogue that were more interesting to you and you wanted more information, best practices, we truly, as an organization, feel that it's our responsibility to do everything we can do to play our role in battling and eliminating the pandemic. And so we really are viewing this weekly series as our best opportunity to share what we can. And in between that, we are more than happy and would be delighted to connect you to other brilliant folks that are doing similar things, whether it's a blueprint of success we have seen, whether it's new inventive ways in which we see health systems using this technology. We have customers that have built systems about communicating to the CEO of the health system because it's just not convenient now to fill out the little card and have the old workflow, to end of life and being able to leverage this very same utility throughout their health system. It's quite remarkable what's happening. And we'd love to share any and all of those best practices. So thank you, audience. Unless there are any questions, we will hope to see you next week. Thank you very much.
Thank you.